Hello, I'm Jane Noyes and I've been invited today to help you demystify funding panels and processes from the perspective of a funding panel chair. Here's my funding panel experience. It's quite extensive. You can see that I've chaired panels for the NHS, for health grants, social care grants, fellowships, project grants, the MRC, all the research councils, as well as research methodology panels and policy research programme panels. So I've got quite a vast experience of chairing research panels over many years. I'm not going to talk so much about the processes. I know that the panel that's with you today is going to spend a bit of time doing that, answering your questions. But my top tip to start with is that do read the guidance documents for applicants published with every funding competition. It's absolutely vital that you do. So top tips for early and mid-career researchers who need personal funding. There's a whole host of funding schemes out there, from doctoral to postdoctoral, early career researcher and mentored chief investigator positions on research grants. So have a look. Your research officers in your universities can help you locate these, but Health and Care Research Wales, as well as the NHS, the research councils, NIHR, as well as third sector organisations, have got a huge amount of different opportunities for you to apply for. So if you're thinking about more early career research to mid-career research, personal funding and fellowship opportunities, essentially these opportunities are designed to prepare the individual to be an independent investigator, hopefully a professor leading a research programme in their field. Although the schemes and assessment criteria vary, they usually assess the following aspects of the application: the person, the project and the place. And if shortlisted for a fellowship application, you're usually called for an interview. So you need to bear all these things in mind as to how you're going to be assessed. So what does good look like? Well, here's Dr. Emily Holmes. She's a health economist. We want to invest in health economists in Wales. We have a shortage of them. She had done a PhD. She applied for a postdoc fellowship. She had just the sort of CV that you'd want to invest in. She had a career aim to be a professor of health economics. She had a project on antibiotic use in Wales. It was very topical. It fitted with current policy briefs. There was a clear imperative that it was important, and it was an important research question. And the project would allow her to extend well beyond doctoral research and take her further down her career intended pathway towards professor. The research project fitted nicely together. It was coherent. It was a really nice training program underpinning it, and it actually answered the research questions that she'd identified. There was a good advisory panel and stakeholders identified that had all signed up and were in place. Again, they were new, some were new to her, so extended her network in preparation for further career development down the line. There was a clear dissemination plan. She was well networked into the right organisations and people. And she had a really well advanced training and development plan that again acted as the vehicle to take her much further down the pathway towards independent investigator and professor. She also really did a really nice job of highlighting why she should be invested in, and she ticked off all the critical success criteria that were outlined in the guidance documents for the applicants. So she made it very easy for the panel members to identify her as somebody that was worth investing in. So moving on now, top tips for researchers who need research project and programme grants to sustain a team. The typical assessment criteria that the panel scores are slightly different. They're more extensive, so they would look at the relevance of the proposed research, the quality of the research design, quality of the work plan and proposed management arrangements, strength of the research team, impact of the proposed work and value for money, and involvement of patients and the public. There's a lot of tips here because my goodness me, these the grant applications vary in quality when they come in, and you can see the good ones that they just jump off the paper at you. So here are some tips. You need to horizon scan to identify potential funding streams and prioritize your applications to maximize use of your time. As I said, read the guide and documents and check the eligibility criteria and remit. We still get lots of applications in that fail at the first remit check. Attend any preparation webinars, ask questions if allowed. Every scheme has a program manager. For some schemes you can access them directly. Start preparing early. Do you have a track record of expertise and research in the area? If not, you need to put the relevant and right team together with the required expertise to carry out specific roles. Build in stakeholder and PPI engagement from the beginning and include an appropriate budget. Importantly, you need to uphold the UK standards for PPI in your entire research plan. Make sure that you're responding to the funder brief. Clearly articulate the policy context and what is known. Has a systematic review been conducted that supports the need for the proposed research? If not, stop and conduct that systematic review. We follow the mantra, no new research unless there's been a synthesis of what's already known conducted. Develop a clear, answerable research question. Select methods that are appropriate to address the research question. Don't jump ahead if there's is there proof of concept, feasibility and pilot data before moving on to a larger study. Create a research design that's coherent and well specified and articulated. Cost the research appropriately and create a defensible budget. Complete all the requested sections of the application form carefully. Get internal peer review and critical friends to read the application pre-submission. Allow the required time to complete all the internal sign-offs and never underestimate that stage, and submit with plenty of time before the deadline, and be prepared to address peer review comments and feedback. So there we go. Good luck, seize the day and give it everything that you've got. Take care everyone. Bye bye.